Hi, thanks for tuning in. We wanted to share a quick COVID update for residents. So thank you to Mary Day, the public health nurse practitioner at Leadville Health District, and Leanne Theodore, our Director of Human Services, for joining us today. Mary, would you kick things off for us?
Yeah, absolutely. Thank you for having me. So what we're seeing in the towns that we serve with Leadville Health District, we are seeing a surge in COVID-19 cases, a sharp rise across the board, with some towns having, a greater rise than others. And we are, with contact tracing, we're learning, what is the reason, or what are the reasons for the surge in cases. And what we're seeing is that social gatherings are, playing a huge role. And, people have COVID fatigue. So, we're all tired. We all want to, get back to life as it was. We want to spend time with our friends, our family, our loved ones. But there's risk there. And we really need to be vigilant. Now is the time. We need to limit our social interactions, continue with our mitigation strategies to prevent transmission. So mask wearing, social distancing, limiting our exposure to new groups. And then, I also want to say a quick word about contact tracing. So, we're very, very busy with contact tracing. And when we call, we're not looking to get anyone in trouble. What we're doing is we're trying to, give everyone the education that they need and provide the isolation and quarantine instructions to prevent further transmission of COVID. So if you get a call from us, if you get a call from Leadville, please answer the call. Please help provide us with your close contacts, because everything you say will be confidential, but we really want to get this under control and contain the spread of COVID, and now is the time.
And Mary, could you just remind us on what is a close contact? What qualifies someone?
Absolutely. So a close contact is anyone who's been within 6 feet for 15 minutes or more. And when we do contact tracing, we are sticking to that definition of a close contact, and that's who we're interested in determining. We've determined the close contacts, and we recommend quarantine for those close contacts. And one other thing I do want to say is that people often tell us that the close contacts, they've all been tested and they're negative. A negative test result does not replace the need to quarantine for 14 days. And that's because there's a long incubation period. So from the time that you're exposed to the virus to the time where you could develop symptoms can be anywhere from 2 to 14 days.
Thank you, Mary, so much. We also recognize that with this request for increased vigilance in terms of limiting your social interactions does take a toll on people's mental health state. So we invited Leanne to talk to us a little bit more about some of the programs we have locally, as well as some of the resources we could connect you to. And just on a serious note, the CDC did a survey over the summer and recently released some of the findings. And they found 1 in 10 of the survey respondents had seriously considered suicide during that time. And when you look just at 18 to 24-year-olds, that number increased to 1 in 4. So we very much acknowledge the impacts of COVID, ranging from unemployment to limiting your social interactions to increased anxiety. It's impacting people in a lot of different ways, and as a community, we hope we can do more to support each other. So thank you to Leanne for telling us a little bit about some of the programs you have.
Thanks for bringing up these very important talking points. And immediately when we started talking about coming on and doing this program this morning, it brought to light our Mental Health Matters campaign. So we had done Mental Health Matters, and we had done a kickoff 2 years ago, basically breaking the stigma of feeling the need to ask for some help. And on this card, it's a small business card. We have them in the town hall, we have them in our offices and other places around the community and doctors' offices. It also has on the back our phone number, which is for free counseling services for all Stonington residents. And it's not limited to youth and family, it's for the entire demographic. We are meeting in person and over the phone, depending on the comfort level of the resident and the counselor and what the needs are. And also on the card is the suicide prevention hotline. Listen, this is challenging for all of us, and then you add in these other factors that families are dealing with right now, like distance learning, that seniors are dealing with, seniors that maybe weren't going out too much to begin with, but we're going to the grocery store and socializing in ways like that are now at home. We've developed a You Are Not Alone program right when COVID had first kicked off, and basically that matches up residents with homebound seniors or other homebound individuals that just would like a daily or weekly check-in call. We've partnered really closely with the police department, and thank you so much to Officer Teresa Hirsch for working with us to do wellness